Welcome, everyone. We'll give everyone just a few minutes to join our webinar on occupational therapy and ABA services. Going to play this one. Just a second. I need to share my screen there. Maggie, can you give me a thumbs up if you can see that one? Perfect. Awesome. While we wait for everyone to join, I'm going to go ahead and introduce myself. My name is Travis Schaus, and I am a board certified behavior analyst, which is a BCBA at Bierman. And I am going to let my co-panelist introduce herself.
Hi, my name is Maggie Rhodes, and I'm the occupational therapist for Bierman ABA in Indianapolis.
Perfect. All right. And while we wait for everyone to join, I'm going to go ahead and talk through our mission, which is to provide support to you, your child, and your whole family. This process is about making daily life easier for you and your child and everyone involved in your child's life. We use behavior analytic research and science to guide our decisions on what to teach and how to teach it. And we're also going to talk about occupational therapy today in this webinar. And while this is important, it can also be intimidating to understand, but we are here to break it down. Collaborate and make your experiences meaningful. And we want this information to be helpful and useful to you. And we also want your input and feedback throughout the process. And please never hesitate to reach out to anyone on your team for support as well. The objectives of this webinar are going to be to define reinforcement and how it is used to change behavior, understand why behavior happens, not just what it looks like, understand occupational therapy's role in pediatrics, and understand how OT and ABA collaborate at Bierman ABA. Our communication via Zoom, I would like an attendee to practice just to make sure our slides are advancing. We've had some problems in the past. If someone can just write yes in the chat box, if they can see the communication via Zoom slide. While we do that, I also want to talk about participation throughout the webinar. It is strongly encouraged and can help you relate to the content and apply it to your daily life. And I'm just going to check my chat. Awesome. I'm getting a lot of yeses. So our PowerPoint is progressing. Thank you so much. And we will pause throughout the presentation to share real life examples. And to share your examples, please feel free to type them into the chat. And there's two icons. You can also use the question and answer, but it'll probably be easier if everyone just puts their questions into the chat as well. And then we can answer them as well. And then at the end of the webinar, we're going to open the floor for questions, and you can just chat those into the chat box, or you can raise your hand at that time too, and we can unmute you. If you do chat your answers, you can chat them directly to the panelists. So in that instance, only me and Maggie can see the answers. If you want everyone to see your answers, you can do panelists and attendees. So at no time will we say your name or your child's name, just to keep that in mind. If you do chat us something that you don't want us to share with the group, that's fine too. Just put that within the chat. So we're first going to start out with a poll. So I'm going to go ahead and launch it. Oops, sorry guys, hold on just a second. All right, hold on. I'm gonna relaunch it. All right, so this is going to look at how much ABA experience you have. So you can vote no previous ABA experience, less than 3 months of ABA experience, 3 months to 1 year of ABA experience, or more than 1 year of ABA experience. I'm going to give you guys a few seconds to answer that question. And this is just going to guide our webinar a little bit based on your answer. All right, great. I'm going to go ahead and end the poll. And I'm going to share my results. So it looks like most of us are in the first category, which is no previous ABA experience. We have a few that are in the newer client category, and a few in the newer client category, and then a few in the seasoned client category. So we have a little bit all over the board. I'm going to go ahead and stop sharing this poll, and I'm going to let Maggie take it away with her poll.
All right, so this poll is just asking about, here, let me pull it up. There we go. Oh, sorry guys. Treva, if you,
Yep, I can launch it.
okay.
Oops.
I think I can relaunch this, see if it works. Nope. Yeah, if you can grab it, I don't know why it's doing this.
Yeah, no problem. Let me go ahead and do that one. I'm going to share the results one more time, stop sharing it, and then I'm going to try it again.
Okay.
All right, let's go ahead and relaunch this one.
All right. So this one's asking kind of the same question, but about OT experience. So the first one's no previous OT experience, maybe less than 3 months of OT, 3 months to 1 year of OT experience, or more than 1 year of OT experience. All right. Give you guys one more second and then I'm gonna share. Okay. And I just click end poll, Treva, is that correct? And I can share it. Okay. All right. So it looks like the majority of people have no previous OT experience, which kind of makes sense. We have a lot of new clients when talking about ABA before in the previous poll, a little bit of less than 3 months, 3 months to 1 year. And looks like someone had more than 1 year experience with OT. That's great. Okay.
I'll stop sharing that one.
Okay. Great. Okay, so next we're going to talk a little bit about occupational therapy services at Bierman. So this first slide just kind of talks about what occupational therapy is. I get a lot of questions about what occupational therapy is, especially with new clients starting at Bierman. So first, I just kind of want to define what occupation is. So it's an activity that occupies your time. And so a lot of our kids here at Bierman have many meaningful occupations. And those include play, social participation, activities of daily living. So think like eating or feeding themselves, brushing their teeth, dressing, using the bathroom, instrumental activities of daily living. So maybe meal preparation for some of our older kids, community mobility, care of others and pets. Education, a lot of our kids maybe go to school also or planning on going to school soon. Leisure, and then sleep. So this next slide just kind of talks about the main focus for OT in pediatrics. We focus a lot on fine motor skills. So your child can grasp and release toys, develop those handwriting skills, computer skills once they're in school, improve eye-hand coordination so they can do those needed school skills such as copying from a blackboard or participating in gym class. And also just mastering basic life skills such as bathing, dressing, brushing teeth, and self-feeding. I think at Bierman, I focus a lot on dressing and fine motor skills and self-feeding skills as well. So this slide just kind of goes in more depth of talking about fine motor skills and gross motor skills, as well as visual motor skills that I work on in OT with the kids. So for fine motor skills, we work a lot on handwriting and the grasp on their writing utensils, scissor skills, and completing a puzzle, grasping the sides of clothing to put on or take off, the hand strength to complete all of those fine motor tasks. So gross motor, maybe throwing and catching a ball, kicking a ball, balance and body awareness throughout their play and their daily activities, maybe while they're getting dressed. So pulling a shirt over their head or placing both their legs into pants during dressing, upper and lower body strength to carry out those activities. And then visual motor, maybe I'm looking at scanning and tracking during handwriting or throwing and catching a ball during play, scanning during completing a puzzle, eye-hand coordination during fine or gross motor tasks, such as bringing a spoon or fork to your mouth, building with blocks. So this is just a quick fine motor poll. So let me see if I can do it this time, Trevor.
Okay.
Okay.
If not, I can definitely launch it for you.
Okay. Okay. All right. Can you see it?
Yep.
All right. So this one is, when is it developmentally appropriate for your child to use a dynamic tripod grasp as pictured when using a writing utensil? So the first answer is ages 1 to 2. The second one is 3 to 4. And the fourth one is 4 to 5. Okay. I'm going to give you guys just one more second, and then I'm going to go ahead and end the poll and share it, and we can talk about it. Okay. So everyone was pretty even across the board. So 4 people said age 1 to 2, 4 people said age 3 to 4, and 4 people said age 4 to 5. So the correct answer is 4 to 5. And I can talk about that a little bit on the next slide. Let's see. Okay, so this picture kind of shows the developmental progression of pencil grasp. So maybe from 1 to 1.5 years, they have kind of that gross grasp there with their fist. And then goes into from 2 to 3 years, digital pronate grasp. So they're kind of holding the with a little bit of a more developed grasp pattern there. 3.5 to 4, they have that static tripod grasp. And then by 4.5 to 5, it's more of that dynamic tripod. And I just added a couple little things that I use a lot in OT with our kids. So just some tips. So one thing I use a lot is I use a smaller or broken crayon. So if you can see that child for the static tripod, he's holding a very small piece of chalk, and that kind of helps promote that tripod grasp there. And then another one I usually do, which that child is also doing there, is writing on a vertical surface. It kind of puts that wrist into an extended position that we would want to see for handwriting. So this next slide is feeding and eating. So what for utensil use, I kind of take a look at how the child uses a spoon and a fork, if they do use a spoon and a fork, and we can work on that. Ability to maintain the grasp on the spoon or a fork, I might recommend built up handles or a weighted utensil. These forks up here in the corner, I recommend these a lot. I've had a kid recently who was having a lot of trouble using a fork that was just like a regular, like long and skinny fork. And as soon as we gave him one of these, he was able to grasp it better and manipulate it way better to use this fork and eat his chicken nuggets. I take a look at children who have a limited diet, and I collaborate a lot with the BCBAs on this. We look at food expansion through food chaining, food plan interaction, step-by-step introduction into new foods and non-preferred foods. So food chaining is like, say you have your child eats chicken nuggets and you really, really want them to be able to eat maybe grilled chicken instead. So maybe we'll do a food chain from that chicken nugget to the grilled chicken. So you might do try the chicken, try a grilled chicken, maybe, and put breading on it. You kind of chain. That's not the best example that I just gave you. So I'm so sorry, guys. I'm going to take a step back for a second. So say you have your child will eat pizza and you really want to get them to eat just maybe a different, I'm so sorry, Treva.
Don't be sorry.
Let me come back to this and talk a little bit more about this in just a second. I also take a look at oral motor skills. So maybe your child's ability to chew foods and keep the food inside of their mouth, or their ability to feel the food in their mouth. Sometimes I see hyposensitive kids who overstuff or pocket the food. So maybe they can't feel the food in their mouth as well. And so they stuff the food in their mouth. And drinking from a straw or an open cup. And then seating at the dinner table, I kind of take a look at how they're sitting. So this child up in the left-hand corner, he's sitting at a 90-90-90 position there. So his feet are flat on the floor. And so his ankles are at a 90-degree angle, his knees are at a 90-degree angle, and his hips are at a 90-degree angle. That's going to give him a really great position to make sure he's stable and supported while he's eating. And that's really important first. And also I talk a lot about conversations around food. So talking about the food in a positive way, trying to avoid saying good for you or bad for you. I always recommend family style serving with the focus not being on your child to limit that child's stress. And a great resource down here, I can probably email this to you guys if you want, is called Kids Eat in Color. It's a registered dietitian, and she talks a lot about talking around food and a lot of different ways that you can help your child try new foods in a non-stressful way. Something else that I talk about and work on with our kids is dressing. So fine motor skills related to dressing. We work on zippers and buttons. A lot of times I use like a dressing vest up here to kind of work on that. Or if we're going to go outside for the day, we work on the zipper. Grasping clothing to pull it on and take it off. Gross motor skills related to dressing. So balancing when putting on your pants, the core strength you needed while sitting to put on your socks or your pants, threading your arms and legs through your pants or shirts. A dressing tip that I added here was that you can use hair scrunchies to pull over the foot first to kind of practice working on socks.
Oh, that's a great tip, Maggie.
Thanks. And then sensory processing. This is something that I could talk for a long time about. People ask a lot about what's a sensory diet. So I wanted to just kind of touch on that quickly. So there are activities that can be implemented throughout your child's day to help reach their sensory needs. And so a lot of times I collaborate with the BCBA on this and to kind of come up with activities that might be helpful throughout the child's day. So I gave kind of an example here. So maybe your child often seeks out climbing or jumping, pushing, crashing into items. So I might say once every hour, try and engage your child in heavy work activities. So some heavy work activities would be maybe animal walks, wheelbarrow walks, carrying heavy items. I might turn into a relay race. Sometimes I'll recommend doing animal walks between activities. So if your child is going from their room to the gross motor room or something, instead of let's just walk over here, maybe we do like a bear walk over there. You might do wall push-ups, pulling a wagon with heavy items. I'm going to talk about this later, but there's these little silicone suction cup toys called Squiggs, and I'll stick them all over the window and the child has to reach up and pull them off. And using all that arm strength is kind of a heavy work task. Completing an activity while lying over an exercise ball, so their arms are weight bearing there. Pulling apart putty or Play-Doh. Sometimes I'll put small beads or Legos inside for the kids to pull out and find. That makes it super fun. Crawling across the crash pad or through the tunnel. Propelling themselves on the scooter board, so they lay on their belly and kind of pull themselves around. Pulling on a resistance band, maybe play a game of tug of war. And sometimes I'll recommend to parents to at home, like maybe you guys got home from the grocery store, see if your kid can help you bring the groceries in. That's a heavy work task. Or helping set the table for dinner, or helping putting the toys away, helping carry something across the house that's maybe a little bit heavier. So like my son, sometimes he has like a bucket of blocks that is kind of heavy, but he can carry it. So we'll do like a little obstacle course and I'll have him carry it across the room as part of it. Those are just a few things. I could talk for a long time about sensory processing. And then alternate seating, I talk a lot to the BCBAs about too. So sometimes kids have difficulty sitting. I take a look at the 90-90-90 that I talked about before first, and kind of see if there's any other alternate chairs that we can bring in. Maybe their chair is just way too tall, way too big for them. We can just look around the clinic and there's usually another chair that suits them a little bit better. I always recommend taking movement breaks throughout the session. A lot of our learners are really are young, you know, maybe 2, 3. So lots of movement breaks. Provide maybe a TheraBand at the bottom of the desk chair. So that yellow TheraBand on that red chair up there. So they can, or I'll put it on the desk in front of them. And so they can kind of rest their feet on it, push against it, and kind of be moving a little bit against resistance without having to stand up so much. Maybe a wiggle seat, which is that blue seat under the child that has the teal shirt on. And that kind of gives them a little bit of movement, and you kind of have to balance a little bit more. A wobble stool is down here on the bottom with the little girl on the blue stool. That kind of gives you some movement there too. Or an exercise ball is also a great one. So what do OT services look like here at Bierman? So consult services. So I might go to Treva. Treva might have a question about her child's seating in their session. Hey, they're moving around a lot. You know, we're having trouble sitting at the table, or we're having trouble sitting at the table to eat. I might come in and say, oh, look, like, you know, see their feet aren't touching the floor. Let me help you find, you know, a good seating option for them. Maybe we can put the TheraBand to rest their feet on and push against if they're just super wiggly. Or, hey, I have this fine motor program. So maybe Treva has a fine motor imitation program, and she's wondering, you know, what's developmentally appropriate. And I can come in and give her developmentally appropriate fine motor actions for her learner to practice in their session. And so that's a non-billable service, is the consult services. So if you saw that your child had an OT consult, that was not billed to insurance. So it's kind of cool getting kind of free OT there. And then I collaborate with the ABA team and parents. So I meet once a month with the BCBAs. And then I pop into parent meetings as I can, at least once every 2 months. I assist with treatment plan goals with the BCBAs, provide input on developmental milestones of fine and gross motor skills, like I just kind of talked about, and then direct services. So if you're interested in direct services, you can always reach out to your ACL, which is probably who you would talk to when you started services at Bierman. And they can direct you to my contact if you're at the Indianapolis location, or they can direct you to whoever the OT is, and you can request an evaluation for OT. So I would evaluate your child and then start seeing them for direct services, usually once a week for an hour. And I would evaluate them and write up their goals based on their evaluation and go over them with parents before starting to see them. And that would be a billable service. And then the evaluation is what I just kind of talked about.
Awesome. Thank you so much, Maggie.
Yeah, no problem.
The second part of this, well, actually, we broke up this presentation into thirds. So Maggie talked about occupational therapy services. I'm going to talk about applied behavior analysis service, which is also known as ABA. And then me and Maggie are both going to convene together to discuss how OT and ABA collaborate across specific skill areas as well. So talking about behavior, I behave, you behave, we all behave all the time. So anything you do or your child does or your boss does or the lady down the street does is considered behavior. So to get a clear picture of a person's behavior, it is important to label the behavior as objectively and precisely as you can. So try to avoid using words like good, bad, not listening, temper tantrum, etc. While those words could relate to what is happening, they do not present a clear picture of what the behavior actually looks like. So we're going to use a chat function for this participation part. What is a behavior that you would like to decrease for your child? So an example of this might be crying. A non-example, so something you would want to avoid would be not listening or a temper tantrum. So really think about what your child's behavior looks like, and then just put that within the chat, and I can get an idea of what behaviors you are trying to decrease for your child. Awesome. So we had a great example of crying. Crying is a popular one. So definitely a behavior that you would want to decrease. And we'll discuss too within the ABA section about the function. So more of the reason why a child might be engaging in a behavior that you're trying to decrease. So we have an example of transitioning. So maybe there's some challenging behaviors occurring with transitioning, yelling or screaming. Those are really great examples. So I'm going to go ahead and move on to the next slide. Feel free to keep chatting me any other types of behaviors that you're looking to decrease within the chat if you start to think of some more too. So thinking about why it's important to think about behavior objectively. So within ABA services, we're going to look at specific behaviors to increase and decrease during the child's daily life. So thinking about if we're looking specifically at crying, we can measure that within our science rather than temper tantrum, which might look different for me versus Maggie, for instance. So if I was saying temper tantrum, I might have an idea of what that looks like, but someone else's idea of a temper tantrum might be different. So an example would be Sammy hits his mom every time he wants a cookie. He is taught to request cookie and gets a cookie to replace hitting for access to a cookie. Now his requesting for a cookie increases and his hitting decreases. So we're also going to talk about what ABA can be used for. So it can be used to increase communication. So looking at requests, following directions, labeling, conversations, answering questions. It can look at play behavior. So independent play, play with a sibling, play with peers. It can look at social behavior, can look at independence. So washing hands, getting dressed. You'll notice a lot of things coincide with what Maggie discussed too. So that's where that collaboration piece is really beneficial. We can also work on food consumption and toileting as well. And those are just the basics. There's plenty of other things that we work on as well. In terms of decreasing, we would look at challenging behaviors. So what we talked about, examples would be hitting, crying, screaming. We might look at stereotypy and how to decrease that as well. And that might look like scripting or discussing a favorite YouTube channel or those type of things. Amount of time to complete a task is something we can look at decreasing, and then the length of challenging behavior. So we're going to look at understanding why. So regardless of what the behavior looks like, your child is trying to communicate what he or she wants or needs. It just might not be the most socially appropriate way to communicate it. So when we shift our understanding of their behavior to a form of communication, we can begin to try to understand it as a type of language. So it's important to remember that our children may not know how to communicate some of their wants and needs with us, or perhaps they do know, but they're just not using it at that moment. But either way, we are here to help them understand how to get the things they want in the most appropriate way. So chances are they are doing what they think is the easiest way to get something. And this is where reinforcement comes in. And reinforcement is a term that we use quite often in ABA. And it is whatever happens after the behavior that increases the likelihood of that behavior happening in the future. So let's look at an example of this. So Timmy wants a bead to finish his craft project. He says bead and his mom gives him a bead. And in the future, when he wants a bead, he requests bead. So the behavior in that situation would be requesting bead, and the reinforcer is the bead. So you'll see in that example that he's requesting bead more often in the future. So that's where reinforcement comes in. That behavior was bead. We saw that increase. So reinforcement is in play. Another example is Cameron wants to swing at the park. She cries when told to wait, and her mom puts her on the swing. In the future, she whines and cries when she wants to swing and does not immediately get it. So you'll see in this example that we have another behavior, which is whining and crying, but still trying to communicate the want of the swing. So let's practice. So let's look at the function or the reason for the behavior. So in ABA, we talk about behaviors occurring for 4 different functions. It could be to access. So a behavior is attempting to get an item, activity, or an environment. So an example of this might be a child saying, I want a cookie. It could be exchanging a picture of a cookie, or pointing or reaching to a cookie, leading you to a cookie, or crying when the iPad turns off because it is not charged. So you'll see that all of those are different behaviors, some appropriate, some not appropriate in terms of socially appropriate behavior, but you'll see that they're all functioning for access. So they're all trying to communicate that a child wants to get an item, activity, or an environment. Behaviors can also be functioning for attention. So that's when behavior is occurring to get attention from someone. So a way that you could get attention would be to hit someone. So hitting to get brother to look at him. That would not be the most appropriate way to get someone's attention. You could also say, can you look at me? Or you can tap someone on a shoulder. Escape would be another function of behavior. So behavior is occurring to get away from something aversive. So an example of this would be running away from broccoli being presented, maybe pushing an item away, or just simply saying no when a worksheet is presented. So all of those are different ways that you can communicate escape. Self-stimulation is behavior that's occurring because it's automatically reinforcing. So an example of this would be chewing on a pen cap. So that's something that I definitely do. Flapping hands, biting fingernails, saying favorite lines of a YouTube video when the video is on or not on. So we're going to take a poll and we're going to discuss the function of the behavior that you mentioned earlier that you would like to decrease. So I'm going to go ahead and launch that poll. And then I'll just read it while you guys respond. So what is the function of the behavior that you had mentioned earlier that you wanted to decrease? So we could have access, attention, escape, self-stimulation, or more than one of the above. So it could be that your child wants a cookie, but also was trying to escape the broccoli presentation. So there might be more than one thing that's happening. I'll give you guys just a few more seconds to respond, and then we'll go ahead and move on to the next slide. Great, so we have quite a few of more than one of the above, so a few different things that are going on. We have some self-stimulation, some escape, and some attention so far. All right, I'm going to go ahead and end the poll. I'm going to share the results with you. So we have kind of across the board. We have some access, we have some attention, we have some escape, and we have some self-stimulation, and more than one of the above. So I'll go ahead and stop sharing. Thank you guys for that participation. So now we're going to talk about positive reinforcement. So we talked about reinforcement. Now we're going to talk about it a little bit further. So positive reinforcement in the simplest form is just getting something that they want. So an example of this would be Lily raises her hand. The teacher calls on her to answer a question. So looking at the behavior is raising her hand. The reinforcement is that the teacher calls on her to answer a question. Example 2, Carson's brother has his favorite toy. Carson grabs the toy from his brother and runs into the other room. So in this example, the behavior is grabbing the toy, and then he gets access to more time with the toy. In the third example, Timmy is in his bedroom playing with his toy cars. Mom comes in and says, all right, Timmy, time to clean up your toys. As a result, Timmy begins to whine. And then Timmy ends up with a few extra minutes to play with his cars. So in that example, Timmy's whining behavior got him a few extra minutes with his toys. Now let's talk about negative reinforcement. Again, the simplest way to look at it is getting out of something unpleasant or aversive. So an example would be Kamal's mom gives him peas for dinner. Kamal begins throwing the peas onto the floor, and his mother takes the peas away and gets him something else. So in that example, Kamal has an aversive situation, such as the peas being presented. He throws them on the floor, and then he escapes that aversive situation. And the second example, Veronica's baby sister begins to scream, and Veronica covers her ears, and then Veronica's mom takes her sister into the other room. So in that example, that aversive situation was that crying, and then Veronica got to escape because her mom took her into the other room. So the key here is that something is taken away after the behavior. So positive is something added, negative is something removed. So we're going to talk about creating a teachable moment. So we talked about the examples you provided about behaviors you wanted to decrease, And now that we understand both sides, what can be modified for a better outcome in the future? So looking at function, so we're going to look at access first. So remember, that's a behavior that is attempting to get an item, activity, or an environment. So you might have a challenging behavior like the one that you had mentioned, so a behavior that you would want to decrease, but you could provide a teachable moment. So if they are crying or whining or screaming and they're wanting access to something and they can vocally communicate, you could prompt, can I have it? Or maybe more time, or give back with a point, or maybe a reach if they're not a vocal communicator. An example of attention, so remember, that's a behavior occurring to get attention from someone. A teachable moment in that situation would be, ideally, we would want to be able to catch these before challenge behavior happens, but that's not always the case. And that's not always the case in ABA services either. So if they are engaging in a challenging behavior, you can wait till they're calm and then you can provide that teachable moment, such as a tap on the shoulder, or such as a look at me request if they're a vocal communicator, or maybe a listen to my story. An escape situation, remember, that's a behavior that's occurring to get away from something aversive. A teachable moment could be not now, a head shake of no, or maybe a first then statement. So you could say first, whatever the situation is. So going back to the Kamal's example, first peas, then cookie. So putting that aversive situation first, but then reminding them that afterwards they get something preferred or a preferred situation. I use that one with my daughter quite frequently, especially with toothbrushing. Self-stimulation is a behavior that's occurring because it is automatically reinforcing as a reminder. So a teachable moment could be using a mouthing replacement. So an example of that would be if you have a child that is mouthing on their shirt, perhaps to get that sensory stimulation, then you could have a chewy replacement. And that's where working a lot with Maggie is really beneficial, because she can look more at that sensory component too, and give us behavior analysts a lot of situation or a lot of examples of what would be the most appropriate mouthing replacement as well. We could work on imitation with toys, so looking at increasing play skills and those type of things. I also want to remind you guys, this is just an introductory webinar, and you might need help identifying a specific replacement or teachable moment for your child based on the function, and that's okay. You might also need help with the function as well. So if you're a current client, I would like you to reach out to your behavior analyst or your clinical director if you need more help with the function or the teachable moment as well, especially based on certain situations. So you might say, hey, I went to this webinar. I am talking about this specific behavior, and I think it's occurring because of access or attention, or hey, I need help and here is the situation. And they can kind of help you with that situation and what could be an appropriate teachable moment in that situation. If you're not a current client and you're on the wait list, you can always reach out to your clinical director, or if you're in interim care services, you can reach out to your interim care provider. And if you're a potential client, you can always reach out to our informational email, and I'll provide you with that at the end of the webinar as well. So a lot of different resources if you are still feeling a little confused on the best teachable moment for a specific scenario as well. So in summary, we try and make sure our children get the things they want for things that we deem socially acceptable, because for too long, many of them got what they wanted for engaging in socially undesirable behavior. And it's our jobs as caregivers to make sure that socially desirable behavior is easy and that they actually get what they want. So an example of that too would be if you have a child that's just communicating with one word phrases. So maybe they just say cookie. In that situation where they're already engaged in a challenging behavior and they're already escalated in that situation, it's going to be really, really hard if you're trying to say, I want cookie, please. They're already escalated. They're already in a challenging behavior. So we just want to make that teachable moment as easy as possible. So just prompting a cookie request in that situation. So sometimes they may lapse, revert to old ways, it's no problem. Just ignore if possible, prompt appropriate language, continue being consistent while attending to the socially desirable behavior. So that behavior that you want to see. That replacement behavior should be easy in that situation as well. We're going to do one more poll, and then we're going to go to how OT and ABA collaborate on specific skills. So I'm going to go ahead and read this one first. So you can tell that Jimmy wants a cookie because he's reaching for it, but you just got home from the store and you have to put the milk in the refrigerator. Jimmy can vocally say that he wants a cookie, but he starts to cry and flops on the ground. So what can you do? So let's take a poll. Let me go ahead and launch it and then we can talk through it. So you could give him a hug. You could have him say that he's sorry and then have him say a longer phrase such as, I want a cookie and I'd like that bigger one over there, please. You can wait for him to calm down and then have him say cookie, or you can give him a cookie while he's crying and flopped on the ground. So I'll go ahead and launch that poll and I'll let you guys respond, and then we'll go into the ABA and OT collaboration. All right, I'll give it just a few more seconds and I'll go ahead and end the poll. All right. These situations are a little tricky too, because we don't have all of the information. So we know that Jimmy is a vocal communicator and he can say that he wants a cookie. So in this situation, the best response would be for waiting for him to calm down and then having him say cookie, because cookie would be a shorter phrase. It would be a phrase that he can say, so that's within his skill set. And we're teaching him to calm down and then applying that reinforcement for that cookie situation as well. So I'll go ahead and stop sharing this poll, and then we'll go ahead and move on to OT and ABA collaboration. So our first topic of interest, and this is a really popular topic with clients, with parents, is feeding. So I'll have Maggie talk through a little bit more about feeding and how occupational therapy would specialize in terms of feeding, and then I'll talk to you a little bit more about ABA.
Okay, so I kind of talked about this in a previous slide, but I kind of look at seating and positioning during meal times and communicate that with the BCBAs. I might observe food preferences. We have a feeding intake that we can send home to parents, and it kind of has parents list out all the foods that their child eats and kind of putting it in categories. So for example, I saw a kiddo's feeding intake where all of his food was all crunchy. He did not eat anything that was any kind of soft. So that kind of tells me that maybe he's seeking out more that crunchy texture that he can really feel in his mouth when he's chewing. So that might help me come up with a good game plan on what foods to introduce next.
Maggie, could I ask a quick question about that?
Yeah.
Like you had talked about food chaining earlier.
Yeah.
So say a caregiver had a client that had a lot of crunchy food preferences, like you were mentioning. How would you apply food chaining in that instance if maybe they wanted, say, a different type of crunchy food?
Yeah, so maybe the child eats a lot of chips, a lot of crackers, a lot of things that are really crunchy, and parents really want them to eat fruit. I might introduce like a freeze dried fruit or a dried fruit. That way, it's still that crunchy texture, and I might even pick something that's maybe not strawberries, because I don't know if you've had freeze dried strawberries, but they're kind of tart, so that might be kind of an alerting flavor to them, but maybe start with an apple or a banana that's freeze dried, and kind of starting with that, introducing it to them through play. Sometimes, say the child really likes trucks, you might put the little bananas on the truck and drive it across the table. Just them interacting and touching it is super helpful to kind of expose them to these new foods that they've never tried. So you might try that first, and then maybe try just like small pieces of the banana, maybe have them interact with it again, and kind of work your way to trying those new foods instead of just, okay, I really want them to try strawberry and just plopping a strawberry on their plate. So I might start with something that's more crunchy. Um, and then, and I did have some more examples of food chaining. I apologize for earlier. I had a thing pulled up and I didn't have it right in front of me. Food chaining is very specific, client specific. let's see. So maybe your child only eats McDonald's French fries, and you really would like them to maybe eat mashed potatoes. Maybe you eat mashed potatoes at dinner often. So maybe you start with McDonald's French fries, and then maybe you try different sizes or brands of fast food French fries that are kind of similar to McDonald's, but not McDonald's. And then you might try some frozen French fries. Then maybe try homemade French fries or tater tots, and then go into maybe potato wedges, and then try baked potato, and then mashed potato. So you're kind of slowly introducing these new flavors and textures without just going straight from a mashed potato or straight from a French fry to a mashed potato. Um,
Perfect.
yeah. Um, another, is there something in the chat? I was looking. Okay.
All right.
So then for utensil use, so I'll look at spoon and fork and collaborate with the BCBA on use throughout the day. So maybe I'll say, they're having a lot of trouble using a fork, and I'm working on using a fork in my sessions for OT. Could you guys try and work on using a fork throughout their day as well? If they have something with them for lunch that they can use a fork with, or sometimes I'll use it within play. So maybe they're really into Play-Doh, and I'm like, hey, when they're playing with Play-Doh, maybe have them try and pick up the Play-Doh with their fork to put it in to the container they're playing with. I might collaborate with the BCBA on food expansion strategies, just kind of what I talked about there with the food chaining. And then I can collaborate with the BCBA on oral motor and sensory processing difficulties with food, like we talked about with the chewy, and we talked about with the really crunchy foods, and just kind of thinking about, is there a sensory component to it, and how can we help this child with that? And then,
Cool.
yeah.
Awesome. And then in ABA, obviously we would collaborate with OT. Most of these are the same things that Maggie had just said. So targeting items that have similar features to preferred foods, which she discussed, utilizing motivation. So kind of to piggyback off what she said, like working on a fork. So if a kiddo doesn't have a lot of foods that they use a fork with, a Play-Doh would be an awesome idea to use with that. And then making it fun too. So utilizing motivation. So maybe they stab the fork and then they feed the Play-Doh to their doll. So working on kind of pretend play in that situation. Reinforcing successful steps towards taking a bite. So maybe they just need to work on that toleration of a different type of food, within their reach, within their table, those type of things. Structuring the day, so limiting grazing, structured time to eat. So you really work on that motivation to eat as well. And then starting small, which goes along with what Maggie was saying as well. All right. What about daily living skills, Maggie?
All right, so I might assess and observe developmental milestones for dressing and toothbrushing. So I might sit down and talk with the BCBA. A lot of times they will put in a program for toothbrushing. Maybe it's a tolerating toothbrushing program. Maybe they've noticed that they're ready for potty training, but they're having a lot of trouble pulling up and down their pants. So I might come in and give them some strategies on how to help with both of those. And then providing the BCBA recommendations for programming related to daily living skills. So maybe I did come in and observe them in a consult, and I noticed that they are having trouble pulling their pants up and down, but the BCBA is ready to start toilet training. So I might say, hey, Treva, I think that you should work a little bit more on pulling up and down the pants first, and maybe try this strategy, try and have them really hook their thumbs into the sides and pull it down. Before starting that, or if they're having trouble with zippers and buttons and dressing, or gross and fine motor skills required to put on and take off shirts, pants, socks, jacket. So I might take a look at those and give recommendations based on what's developmentally appropriate for them.
Yes, and in terms of ABA, we would be looking at component skills. So also working on all of the daily living skills like Maggie was talking about, but also looking at like pinching if we were looking at zipping. So maybe they need a fluent pinch as well. They need a fluent reach and a fluent pull and those type of things, reinforcing successful steps, looking at promoting independence in current life skills. So just like what Maggie was saying, pants up and down for potty training, looking at the generalization. So if they do have zipping, can they do it across multiple zippers, across all different types of zippers, across all different types of materials, maybe multiple soap dispensers, if you're looking at that push motion, splitting larger skills up into smaller skills. So thinking about all of those different types of behaviors in toothbrushing. So opening the toothbrush, squeezing, or opening the toothpaste, squeezing the toothpaste, all of those things, and splitting those into smaller skills as needed, providing prompts when needed. So maybe they're really great at a lot of skills within toothbrushing, but they need a prompt for how to brush the different quadrants of the teeth. And then targeting toleration if necessary. So going back to that toothbrushing example, maybe they won't even tolerate the sight of a toothbrush or toothpaste. So working on tolerating that within specific smaller steps first. So maybe just the presence of toothpaste. Maybe we work on brushing a doll's teeth and making that a little bit more fun as well. All right, what about fine motor and gross motor skills?
All right, so I provide the BCBA with developmentally appropriate fine motor and gross motor imitations for programming. So sometimes the kids work on fine motor and gross motor imitations. So I might come in and say, I think that, the thumbs up is a great skill at this moment for them. Or I collaborate on the different skills within play. So maybe they have a reciprocal play program, and I kind of give examples of different appropriate skills within play that they should be able to do and that they could target within play. I also might collaborate with the BCBA and the school readiness coordinator. Some of our clinics in Indianapolis have a school readiness coordinator, and they focus on a lot of school readiness skills for our kids who are getting ready to transition within the next year or so. So I might look at scissor skills and handwriting skills and provide developmentally appropriate scissor skills for them. So for example, say your learner is maybe 3 years old and they're just learning how to use scissors. I'll say, hey, they are probably just going to be able to snip the paper. So maybe start with that. And so maybe after snipping the paper, just have them work on cutting the paper in half. And then maybe after that, have them cut along a line and kind of progress that way. And then I might observe and assess gross and fine motor skills within dressing, play, feeding, and eating, and communicate that with the BCBA as well.
Yeah, and to piggyback off of that, ABA would also be looking at the motivation. That could look into fine motor and gross motor within play as well, kind of building upon that child's motivation. Imitation, so looking at motions that look similar versus dissimilar. So if you have a kiddo that's just learning how to do gross motor imitation, this motion versus this motion are going to look really similar, but this motion versus this motion are going to look very, very dissimilar too. We would also look at expanding reinforcers, so those preferred items that we can use to reinforce those appropriate skills. And then potential for a communication device or picture exchange. So looking at like a picture exchange for a communication for a non-vocal communicator would be a pinch and a grasp and a reach and a release. And then a communication device could be looking at the pointing as well. So that would be the fine motor domain. And then I will start with this one. So we just have a few OT and ABA resources that we thought could be beneficial. So there's a Fireworks Tap app. It's a free app and it's just a black screen. And when you touch it, there's fireworks. So that's a really great and fun way for a kiddo to work on that pointing and kind of reinforcing that as well and making that a little bit more solid. There's also a bubble wrap app, which can also work on pointing, which is a free app. Sensory bins are another great skill that can work on sensory. So there's an example right here with the rice. So kiddos can play with the rice. They can work on sorting. So they can work on those colors within that. They could also work on language skills. So you can say, hey, find the rainbow, or you can have them label the rainbow. So a lot of really great skills just within that one activity. There's also a book here called Broccoli Boot Camp that focuses on feeding and feeding strategies. And I'm going to let Maggie talk through the rest of these toys.
Okay. So another one that I mentioned before called Squiggs up in this top left-hand corner there. They're just these little silicone suction cup toys, and they can kind of stick to, the table, the floor, if you have like a hardwood floor or hard floor. I use it a lot on the windows, so I'll put it on the windows and have your child pull them off. Sometimes I'll work on crossing the midline, so maybe I'll put some squigs on the left and some squigs on the right, and I want them to reach across and grab them. And you can also build off of them if you can kind of see. It's just a great tool to work on for like a heavy work task, like I brought up earlier, but also working on that grasp and getting that hand strength, upper body strength that they need for all those fine motor, gross motor play skills. Another thing are these peanut balls down here, the blue and the yellow. I use these a lot for somewhere to sit to work on balance while they're working on an activity at the table, or I have them lay on their belly over it and kind of support themselves with their arms. So they're kind of getting that heavy work there too. They're getting that sensory input through their joints and also working on that upper body strength. And I'll kind of put like a puzzle on the ground. Maybe we'll do a puzzle while they're laying. Maybe we'll whirl across it back and forth. And then let's see, scissor tongs over here in the bottom right corner. There's some scissor tongs. This is the little, I think you can get it off of Amazon. It's a little pack of them. But the scissor tongs are great to start working on scissors. So like the sensory bin Treva talked about, I a lot of times use that in the sensory bin so we can scoop and pick them up and work on that scissor skill without first going to the scissors. Slightly easier. And then the therapeutic is down here in the bottom left corner. And I think I touched on it earlier. I'll put beads in it. I'll put little Lego people that I'll take apart. And so the child has to pull it apart and really use that hand strength there and manipulate that and pull out, find those Lego pieces, and then gets to build them at the end and play with them. And then Handwriting Without Tears resource is really great. This book here in the green book there, it kind of works on handwriting, starting with kind of the easiest letter to learn how to write first and then progressing. And I've used this with a lot of my kids, just working on tracing letters at first. I think my first school book is really just working on tracing and building the letters, and I'll build them with Play-Doh, or I have wooden pieces that we can build letters with. That's from the Learning Without Tears site. It's just a great resource if you feel like your child needs a little bit more practice with the handwriting. And then the frog feeding game down here, I really like this to work on fine motor skills. You have to squeeze the sides of the frog's face to get it to open. But I've also used it a lot in feeding. So I'll have the frog sitting with us at the table. Maybe, we're trying a new food and I'm like, hey, let's feed it to the frog. And so your child has to feed it to the frog first. Maybe the frog's eating it. The frog thinks it's really tasty. Even if we're not going to try it that day, just interacting with that food and feeding it to the frog. Or if you're working on using a fork, and so you're going to use, maybe you're using Play-Doh. So maybe you pick it up with the fork and then feed it to the frog. And it's just like, you can just wipe it right off or take it out. It's pretty easy to clean off.
Perfect. Thank you, Maggie. Yeah. We're running a little short on time, so I'm just going to cut to the frequently asked questions. So a lot of times I get asked if the webinar is recorded, which it is, and a link will be sent to you a few days after this webinar with a link to the Bierman YouTube channel. So you can check out any resources or any slides that you would want to review again on that recording. And then can you access previous webinars? So all previous webinars are on the Bierman YouTube channel. So I will send that link out to you in a few days after this recording as well. Our future webinars, so March 17th, we've talked a lot about feeding tonight, and we're going to talk even more about it on March 17th on a webinar, so feel free to sign up for that. April 7th, we have another introduction to ABA and Occupational Therapy services, so it's going to be the same webinar, but maybe you have another caregiver or someone in your family or a friend that you think would be beneficial to attend, and feel free to have them register for this webinar. April 17th, we have a play webinar as well. So that's going to work on developing play skills. I do have the link on this slide, and I also have it on the email when I send that to you as well, that follow-up email. I'm going to open the floor for questions. If you want to chat any questions to me or Maggie, I would like to give a disclaimer that we can't give any advice based on any specific scenarios that you would give us, just because we don't have all of the components to analyze it thoroughly. But if you have a specific question, so maybe it would be, we talked about food chaining tonight, and you're interested on how to apply that specifically with your child, you could contact your child's behavior analyst if you're a current ABA family and services. If you're an interim care family, you could contact your interim care behavior analyst. If you're on the wait list, then you could contact your clinical director. And then for all other families, you can contact this email, but I will also be sending a follow-up email in a few days, and you can also ask me those questions as well. So go ahead and ask us any questions that you had pertaining to this webinar. If it's a longer answer, then I might just get your name and I can email you the answer as well. Thank you guys so much for coming too. We appreciate all of the active participation and all the great questions about occupational therapy and ABA services. No questions? While we wait and see if anyone else has any more questions, Maggie, is there any other additional information you would like to add about occupational therapy?
I don't think so, but Trevor, did they get my email on this to ask any questions, or?
I can add your email to the
Okay.
follow-up email that I have. So if you do have any occupational therapy or ABA questions, I can add both of our emails to the follow-up email, and you can definitely reach out to us. Awesome. Well, thank you guys. You will also have our email. So if any questions do come up, I know we shared quite a lot of information for you, so you might need to think about them as well. We do have one more question. So it looks like a duration question for dinner. So sometimes dinner takes a little bit longer. So any tips on focusing on that? So yeah, that would definitely look like a behavior that you would want to decrease. Maggie, do you have any thoughts on feeding in terms of duration and length of dinner?
Is it more so they're kind of chewing slower and just taking their time, they're getting distracted, or is there any other I think it's what you were saying, Trevor, how it's kind of hard to know all the components of each question. Distracting himself. Okay, great. I thought maybe that was it. My son also gets super distracted at the dinner table. When he or she is sitting at the table, do you guys have a TV on or anything? Sometimes I'll suggest lowering the distraction, so no TV or tablets. And I know that's tricky. Nothing. Okay. I don't have any suggestions at this time, just with this information. But this is a great question. Do you have any tips on that, Treva?
I think with that one too, I would just reach out to, if you are a current client, your behavior analyst, and then if you're not a current client and you're on the wait list, the clinical director, and then they can get a little bit more information on that too, because there could be different factors that are going on that we don't quite know about and can't analyze like quite as well as we would need to kind of give you some more helpful situation. I think Maggie gave some general feeding ways of how to structure meals in terms of like family portions and those type of things. But I would definitely reach out to one of these contacts as well to get more information on that as well, and to get some child specific advice. Great question. All right, if there's no more questions, I'll go ahead and stop the webinar. Thank you guys so much for attending. We appreciate it. And I hope that you attend some other webinars in our caregiver series. Thank you.